I'd like to welcome you to Doctor in the Making, where we will be discussing all topics related to medicine with the top influencers and doctors in the state of Florida.
Hi, I'm Dr. Pero. We're going to talk about heel pain today. We just did a case in the office today for plantar fasciitis. Plantar fasciitis is probably one of the most common reasons for people to have heel pain. And heel pain is probably the most uncomfortable thing you can have when you're walking because the pain is right on the heel every step of the way. On the bottom of the heel, there's a ligament called the plantar fascia. It starts here at the bottom, and then it's flat and it goes out and it fans out all the way up until the front of the foot and the toes. Now that ligament is primarily responsible for just maintaining some structure of the foot, helps maintain the arch. And after so many years of walking on our feet, you can develop wear and tear injuries on that ligament, usually right where it attaches on the bottom of the heel, and sometimes also in the arch. And sometimes that ligament can be very tight if you haven't stretched very much. Over time, you can develop a lot of scar tissue within that ligament, and it's usually right on the bottom of the heel or just beyond it as it goes into the front of the foot there. We have an x-ray here. This is actually the heel bone right back here. So you can see right where this line is here, that's where the fascia is going up into the foot. Sometimes on an x-ray, people will have a heel spur in that area. And usually if it's a small heel spur, it usually means that it's not been there for too long. If it's larger, this is a process that's going on for a long time. Although the presence or absence of a heel spur is not always an indicator of how much pain you could have. Some people can have really bad plantar fasciitis pain without having a heel spur, or vice versa. They might have a heel spur but no real pain. But what we usually consider this entity is as heel spur syndrome, whether or not there's a spur or not. The pain is usually coming from the plantar fasciitis. There's lots of conservative treatment for this, and that can range from anywhere from stretching, icing, rest, wearing certain shoes with a good arch, a device called a night splint that'll help stretch the fascia, pulling it back like this, physical therapy, massage, steroid injections, and then various different types of arch supports or shoe inserts, or we call them orthotics. Some of them are made over the counter, and they're just sold by size. Some of them are custom made, and there's different ways of doing that as well, which can help do two things basically. It can help relieve the pressure from the heel because you have more pressure going in the arch. And it also will actually raise the arch up a little bit when you're standing rather than having your arch flatten out. Because if the arch flattens out when you're standing, it's essentially going to pull the fascia on the insertion of the heel like this as the arch flattens out. It can be very painful. There's been some advancements in the past 5 or 10 years, and we did a procedure today called a 10X procedure, T-E-N-E-X, from the 10X Health Company, where we're using ultrasound technology to go in percutaneously, just 1 or 2 very small little stab incisions that don't even require stitches. We just use steri-strips to close it. And we go in with this small probe that basically goes right where the scar tissue is here, and it shoots out a ultrasound energy that breaks up all that scar tissue. What it also does is shoots in some saline and sucks out saline at the same time to get rid of that scar tissue that we just debrided or that we just basically cut away, leaving all the healthy tissue intact. So it's a really cool procedure that can be done in the office or outpatient surgery center or hospital if you choose. It can be done under local anesthesia or IV sedation or general anesthesia. We did one today in the office under local anesthesia and it went really well. Basically going in there with a couple incisions, cleaning out the scar tissue, steri-strips. And these patients are walking the same day because the incisions are so small. We're not causing a lot of trauma to the area, and they're walking in a cam walker boot right after surgery with no pain. They stay in the boot for about 2 weeks, and then after that time, they transition into a comfortable tennis shoe or a sneaker over a few days or a week, and start physical therapy at that time to get your range of motion and strengthening back, and also to get rid of any of the swelling or pain that you have just from the surgery itself. So overall, this is a great procedure. I recommend you check it out if you're ever having heel pain from plantar fasciitis.
Thanks for watching. If you like this video and you want to see more, click the like button below and follow me on Instagram at @DoctorInTheMaking_. Also, if there's a topic you'd like to see us talk about, make sure you let me know in the comment section below. And always remember, be grateful.